So here's my version of the brachial plexus. This would be the version of a left arm. Remember, anatomic positions down here. We're kind of drawing it as if the arm were out here. The brachial plexus is fed into by what are called roots. Roots of the brachial plexus are just the anterior ramus of a spinal nerve of C5, C6, C7, C8, and T1 with a little bit of input from C4. So each spinal nerve gives an anterior ramus that become the roots of the brachial plexus, and like I said, with a small input from C4. From the roots, the brachial plexus forms trunks. The C5 and C6 roots form together as the upper trunk. The C7 root continues as the middle trunk. The C8 and T1 roots come together as the lower trunk or inferior trunk. From here, divisions form. The formation of divisions means this part of the brachial plexus determines whether the nervous system will be in the anterior compartment of the arm or the posterior compartment of the arm eventually. So the anterior division, like it sounds, makes its way into the flexor components, the anterior brachium or the anterior antebrachium. The posterior division makes its way into the posterior brachium, posterior antebrachium. So the anterior division is formed when the middle trunk and the upper trunk combine together, and the inferior trunk continues. That's the anterior division. The posterior division is formed from a branch from all three trunks. So the axillary artery would be sitting in this area here, anterior to the posterior division. After divisions are formed, we have chords. There are three chords: a lateral cord, posterior cord, and medial cord. If you think anatomic position, that makes sense. From here, we have terminal branches of the brachial plexus. Terminal branches of the brachial plexus, there are 5 of them. From the lateral cord, we have the musculocutaneous. And a branch to the median. From the medial cord, there's the second branch to the median. And also from the medial cord, we have the ulnar. This would be ulnar nerve, median nerve. From the posterior cord, there are 2, axillary and radial. So we'll talk about the terminal branches in a second. Prior to the terminal branches forming from the brachial plexus, there are some nerves that branch off prior to these terminal branches forming. So those nerves are as follows. From C5, C6, and C7, really close proximally here. So this would be deep to the scalene muscles, the anterior scalene. We have the long thoracic nerve. From the C5 root, we have the dorsal scapular. Nerve. Long thoracic nerve is going to be found on the external surface of the rib cage going to the serratus anterior. Dorsal scapular nerve is going to be found going to the medial border of the scapula to innervate the levator scapula and the 2 rhomboids. From the superior trunk, we have the suprascapular. Suprascapular nerve dives under the superior transverse scapular ligament to make its way into the supraspinous fossa, innervating the supraspinatus and then eventually the infraspinatus. We also have a nerve to the subclavius, which, just like it sounds, innervates the subclavius. From the lateral cord, we have the lateral pectoral. Lateral pectoral innervates the pectoralis major. All of these nerves so far are motor nerves. They do not supply cutaneous sensation. If we go to the posterior cord, the first one that comes off is called the upper subscapular. The second is called the thoracodorsal. And then the third is the lower subscapular. And these are branching off the posterior cord prior to the split between the axillary and the radial. The upper subscapular innervates the teres major and innervates the subscapularis. The thoracodorsal innervates the latissimus dorsi. And the lower subscapular also innervates the subscapularis. Sometimes it just gets the name nerve to the subscapularis. All three of those are also motor nerves. Off of the medial cord, first one is the medial pectoral. The medial pectoral pierces the pectoralis minor, innervates it, goes on and innervates the pectoralis major. Then we have two cutaneous branches. We have the medial brachial cutaneous and the medial antebrachial cutaneous, both of which innervate their respective parts of the arm. The medial brachial cutaneous innervates the skin of the medial arm. The medial antebrachial cutaneous innervates the skin of the medial forearm, but not the hand. The medial brachial cutaneous, medial antebrachial cutaneous are strictly sensory nerves. The medial pectoral, lateral pectoral are strictly motor